Good evening. Tonight I'm going to present our final project of operations management, in which we have analyzed the dental clinic where my mother and my aunt work for. My group is Achilles, Enzo, Isabella, Isadora, Marcelo, and I'm Clarissa. I'm going to start presenting the analysis of clients and competitors. The clients were provided with a questionnaire in which we asked them to rank some attributes from 1 to 9. 1 is really important and 9 is really not important. So the most important attributes for them were result of the service, cleaning, and attentiveness of the dentist. So we put them on a scale of 1 to 9, and those attributes are the winners. Moreover, we asked the clients to compare the clinics with others of the same standard, and most of the most important attributes were considered of a superior quality when compared to competitors. Some attributes such as time in the waiting room were considered worse, and we're going to talk about them later. It's important to highlight also that the ability of the professional was an attribute which we did not ask the clients, but lots of them mentioned them as another winner, and they also said that my mother and my aunt outperform competition. So it would be attributes such as time in the waiting room were considered worse, and we're going to talk about them later. It's important to highlight also that the ability of the professional was an attribute which we did not ask the clients, but lots of them mentioned them as another winner, and they also said that my mother and my aunt outperform competition. So it will be right here in the appropriate area. Now I'm going to present an evaluation of the service process and the service characterization. So the service process is a low volume one, and this is an option of the dentists because they work in a private clinic with indicated patients. And it's different, for example, from a health insurance program, which is a low-cost rival, because the strategy of my mother and my aunt is to offer a handcrafted dentistry with high precision, a high quantity of details, and it's also very conservative because its focus is on the health of the clients. And the low-cost strategy, on the other hand, would offer a really quick treatment and standardized, but on the other hand, the quality would not be that high, so the price would be lower as well. So we observed that the value proposition of my mother and my aunt would be to offer a highly customized, handcrafted dental service with special attention to the clients and commitment to the most healthy and aesthetic result. About costs and revenues, the revenues are based on Tabela Nacional de Convênios e Credenciamentos, and it's multiplied by a factor according to the region and the materials they used. So since they operate with differentiation strategy, their materials are of superior quality. And the highest costs are exactly the storage of the materials, because they need to have materials for every different procedure that appears. And they also have some costs with equipment for it. Furthermore, we could offer a suggestion, which is to develop a material to really explain to the clients why their service takes longer than a health insurance program and why its price is also higher. And that is because they are really differentiated and focus on health and aesthetics at the same time, not only one of them. That's it. Now we are going to present the production process. We would like to highlight the fact that quality issues tend to be few because they focus on highly differentiated dentistry, and in case there is a problem, they control it on the same session usually. So this guarantees a high quality, almost Six Sigma standard. And also the suppliers need to be really trustful because they need those high quality materials whenever they need. We made an ease map in which the blue is what comes from the patient and the pink is what comes from the dentists, and it comes from indication to the first contact. Then when the client contacts them, they check if it's urgent, and if the treatment is really urgent, they put the client in front of the others. Then in the treatment itself, they usually give priority to the treatment of caries and canals, and afterwards they treat the aesthetical part. Except in some specific situations in which the aesthetics is really a priority. Now I'm going to present the process mapping, which goes from indication to maintenance and prevention. So the client is indicated, and then the dentist checks if it's an urgent case or not. If it's urgent, the client goes in front of the other ones in the scheduling. And then going to the treatment itself, the dentists have to check if aesthetics is a priority or not. Usually, they start with the treatment of caries and canals, but sometimes, in some specific cases, they need to start with the aesthetics treatment. For example, if the person is going to get married the next day. Then, parts of the job is performed by the prosthetic, who does some adjustments and makes some pieces for the clients. The dentists and the clients control the quality of this job, and they need some final adjustments and maintenance and prevention. What should happen in a should map is less time in the waiting room, or even ideally no time in the waiting room, and the clients should not consider aesthetics a priority. They should prevent, so they could always treat health as a priority. And then with these inputs such as dentists, patients, equipment and materials, they do the treatments, getting an output which is a healthy client or aesthetic result. In the same session, they control the quality, and they have some feedback, for example, asking the client periodically if everything is okay. About risks and problems, we develop a Pareto chart and a fishbone analysis, and we came up with the problem of waiting time, which could be corrected with a better scheduling. So they should have more slack between one patient and the other, in a way that their clients don't have to wait a lot on the waiting room. And this could also solve the problem of they asking for a quick session, because sometimes the session can seem long because it's added to the time in the waiting room. And it's also a trade-off. If you want a quick session, you will probably get a lower quality. Now we are going to talk about layout. We observed that the dental clinic has a fixed position layout because the client is fixed and the tools, the dentists come to them. They also have some aspects of the cell layout because the dentist moves through several different equipments such as sterilization, sink, fluorine, and so on. And it's also a product layout because the client is the one who comes to the clinic. About the attribute control chart, they treat a specific session as acceptable or not, and to check that, they do some assessment in the session itself, and then on the following day, then 1 week after, and they also have a control session, as I have mentioned previously. And then it's a trade-off because it's very difficult to reduce waste if they want to have a Six Sigma quality, because, for example, they need high inventories. Now we are going to talk about the attribute control chart. They control each session as acceptable or not, and they do this assessment in the session itself. Then they check in the following day, in the following week, and in the following session to see if the quality is okay. They have a Six Sigma strategy, but on the other hand, they cannot eliminate much waste because, for example, the inventories need to be maintained, need to be kept high, as I mentioned previously. So it's very hard to eliminate this waste. Also because some inventory gets expired after some time. And the wait is something that they have to improve, the waiting time for the session. About the theory of constraints, we analyzed the time that it takes in the procedure, considering asepsis procedures, general health analysis, the treatment itself, and the sterilization. And the bottleneck in this case is the treatment session. Increasing efficiency would be positive, provided that it doesn't impact quality. So in order to improve quality, they should actually have more modern equipments when they are developed, which they already have. About capacity, the dentists, they can help half patient per hour, because one patient takes 2 hours to be treated, as we observe here, and they can work up to 14 hours a day, but they leave a cushion of 29% to allocate urgencies. So this is the way time happens. And something to highlight in this topic is that the purchasing orders happen once or twice a week, and they control it daily. So when they have one package left, they order, and they tend to join orders together to have better price.